Hello everybody. I want to share with you today something called the 80-20 rule. Some of you might have heard of this before. It's often thought of in terms of productivity or efficiency or personal development, but I was really thinking about this 80-20 rule in relation to health recently. I was listening to a podcast about Alzheimer's and cognitive decline and some novel therapies and treatments, and it really struck me that this doctor was listing off all of the things that you've heard before and that I've heard before, the same things that would help us to have stronger immune systems, same thing that would help us to stave off diabetes, heart disease, a lot of the other chronic degenerative illnesses that are so prevalent right now. And probably about 80% of his recommendations were what I see for these other diseases. And I'm thinking of this 80-20 rule. And for those of you that have not heard of the 80-20 rule, it basically means that about 80% of your outcomes or your results are related to a very crucial 20% of your activities. So if you really prioritize or focus on those important 20%, you're going to have a powerful output, about 80% of your outcome. So again, people use that a lot in terms of efficiency and scheduling and personal development, businesses, but I really thought how this carries over into health. So many different of the things we often take for granted, we think of them as just being too simple to be effective. They're the very things that are part of that 20%. They're going to help translate into better health for us overall in terms of staying clear of some of these chronic conditions and immune system struggles and issues that we have. So what are some of those 20%? You already know them. We just forget about them. And they're simple. Improving the quality of our sleep, improving our hydration. Are we getting outside? Are we moving? Are we taking care of our mental health? Are we doing things like meditation? Are we grateful? What is our food input? How are we relating to others? All of these simple things, they seem simple, but we need to make sure we're putting them in those 20% for us, for our schedule, for our priority, to be able to get that 80% outcome. Now, in terms of we haven't talked about the coronavirus lately. It's been a few months since we've done anything on the video there, but much of this applies to the way we take on this virus too. If we're not careful, too much of our focus can be on things outside of our control. Trying to stay clear, avoidance, trying to avoid the virus. And so those are things like the masks, the distancing, the washing the hands. These things are all fine, but these are all trying to avoid versus trying to build up our immune system. Another podcast I listened to recently was a doctor from the Cleveland Clinic. They straight up asked him, what was your number one recommendation for people looking to improve their experience when they do encounter the coronavirus, or to have a stronger reaction and not end up in really bad shape with this coronavirus? And point blank, he just said, do everything you can to improve your own personal health. He didn't get into the other items because we all heard that, and we've been hearing that for a year, but those things are largely trying to avoid versus trying to build ourselves up. So remember, what can we do to improve our capacity, work on that 20%? And the other thing is, we don't want to let fear override our mindset right now. And a couple examples in terms of the COVID-19 with the fear, there's always this fear that we're not doing enough, whether it's the masking, maybe one mask isn't enough, we need two. Maybe 6 feet isn't enough. If you're going to be singing or celebrating, then you need even more than 6 feet between people. And then even the vaccinations, no matter what your stance or about the vaccinations, there's a concern or a fear that what if the antibodies aren't lasting long enough? What if the variants that are coming here the vaccine's not going to work for those variants? So you can kind of see how these other outside-in approaches, there's limitations to those, and there's fear. So I'm just encouraging you all to take heart, to take a priority in the things that you can control for your own personal health, your family's health, those 20%, the things we hear about so often, but we sort of underutilize, to build yourself up as part of that 80-20 rule. Take care. We'll talk to you next time.